Top 25 NHS Nursing Assistant Interview Questions and Answers. In this video, we will explore the top 25 interview questions commonly asked for NHS nursing assistant positions. Each question is designed to assess your skills, experience, and suitability for the role in a healthcare setting. We will also provide detailed answers and tips to help you prepare effectively. By understanding these questions, you can enhance your confidence and performance during the interview process. 1. Why do you want to work as a nursing assistant in the NHS? I want to work as a nursing assistant in the NHS because I am passionate about providing compassionate care to those in need. The NHS represents a commitment to high-quality healthcare, and I admire its focus on patient-centered care. I believe that my skills and empathy can contribute positively to the well-being of patients. Working in such a diverse environment will allow me to learn from experienced professionals while making a meaningful difference in people's lives, particularly during vulnerable moments. The opportunity to support patients and their families aligns perfectly with my values. 2. Can you explain your understanding of person-centered care? Person-centered care focuses on treating patients as unique individuals with specific needs, preferences, and values. It involves actively listening to patients and encouraging their involvement in care decisions. This approach ensures that care plans are tailored to each patient, promoting their autonomy and dignity. Building trusting relationships and open communication are essential components. By understanding the patient's life context, healthcare providers can deliver more effective and meaningful care, leading to improved patient satisfaction and outcomes. 3. What do you know about the 6 C's of nursing, and which do you think is most important? The 6 C's of nursing are care, compassion, competence, communication, courage, and commitment. Each of these elements plays a vital role in providing high-quality patient care. Care refers to the attention and support given to patients, while compassion involves understanding their feelings and needs. Competence is about having the necessary skills and knowledge, and communication ensures clear interaction with patients and colleagues. Courage involves advocating for patients and making difficult decisions, while commitment reflects a dedication to providing exceptional care. I believe compassion is the most important, as it forms the foundation for trust and healing in patient relationships. 4. How would you handle a situation with an aggressive patient? When faced with an aggressive patient, my first priority is ensuring the safety of everyone involved, including myself, the patient, and other patients around. I would remain calm and composed, using a soft tone of voice to de-escalate the situation. Active listening is essential. I would try to understand the patient's concerns without interrupting. If possible, I would remove any unnecessary stimuli from the environment. If the aggression persists, I would seek assistance from colleagues or security, always prioritizing a respectful and compassionate approach to the patient's needs. 5. What is your understanding of confidentiality in healthcare? Confidentiality in healthcare refers to the ethical and legal duty of healthcare professionals to protect patient information. This includes personal details, medical history, and any discussions related to their care. Ensuring confidentiality builds trust between patients and healthcare providers, encouraging open communication. It is essential to share information only with authorized individuals involved in the patient's care, following relevant laws such as GDPR and HIPAA. Breaching confidentiality can lead to serious consequences, including legal action and damage to the patient-provider relationship. 6. Describe a time when you had to prioritize tasks in a previous role. In my previous role as a healthcare assistant, I faced a situation where multiple patients required immediate attention simultaneously. One patient had a fall and needed assessment, while another was requesting assistance with personal care. I quickly assessed the urgency of each situation, prioritizing the patient who had fallen to ensure their safety. I notified the nursing staff while providing reassurance to the injured patient. Once that situation was stabilized, I returned to help the second patient. This experience taught me the importance of remaining calm and organized under pressure. 7. How would you contribute to maintaining a positive team environment? Creating a positive team environment involves effective communication, mutual respect, and collaboration. I would actively listen to my colleagues, valuing their input and acknowledging their strengths. I would encourage open discussions where everyone feels comfortable sharing ideas and concerns. Supporting each other during challenging times is crucial, so I would offer assistance when needed and celebrate team successes, no matter how small. By fostering a culture of appreciation and understanding, I believe we can create a supportive atmosphere that enhances team morale and improves patient care. 8. What experience do you have with providing personal care to patients? In my previous role as a healthcare assistant, I provided personal care to patients of varying needs. This included assisting with bathing, dressing, grooming, and toileting. I ensured that each patient felt comfortable and respected during these intimate tasks by communicating openly and maintaining their dignity. I also took the time to understand their preferences and routines, which helped build trust. Additionally, I monitored their physical and emotional well-being, reporting any concerns to nursing staff promptly to ensure they received appropriate care. 9. How do you ensure high standards of hygiene and infection control? Ensuring high standards of hygiene and infection control involves several key practices. First, I prioritize thorough hand hygiene, washing hands regularly with soap and water or using hand sanitizers when necessary. I adhere strictly to the protocols for personal protective equipment, PPE, ensuring that I wear appropriate gear such as gloves and masks when required. Additionally, I regularly clean and disinfect surfaces and equipment used in patient care. I also stay informed about the latest infection control guidelines and participate in training sessions to ensure compliance with best practices in the healthcare environment. 10. Can you describe a time when you demonstrated empathy in a challenging situation? During my previous role as a caregiver, I encountered a patient who was experiencing severe anxiety about their upcoming surgery. They were visibly distressed and reluctant to engage with staff. I took the time to sit with them, listen actively, and validate their feelings. By sharing my understanding of their fears and providing reassurance about the care they would receive, I helped to create a calm atmosphere. This approach allowed the patient to express their concerns and ultimately eased their anxiety, fostering trust and a sense of comfort as they prepared for the procedure. 11. What would you do if you noticed a colleague not following safety procedures? If I noticed a colleague not following safety procedures, I would first assess the situation to ensure that immediate harm is not occurring. If it is safe to do so, I would approach the colleague privately and express my concerns in a constructive manner. I would remind them of the importance of safety protocols for the well-being of patients and staff. If the behavior continues or if it poses a serious risk, I would escalate the issue to a supervisor or manager to ensure that the appropriate actions are taken to maintain a safe environment. Communication and teamwork are vital in addressing such situations. 12. How do you stay calm and focused during busy or stressful shifts? In busy or stressful shifts, I prioritize effective time management and organization. I break tasks down into manageable steps and focus on one task at a time, which helps prevent feeling overwhelmed. Taking deep breaths and maintaining a positive mindset also aids in keeping calm. I find it essential to communicate with my team, as supporting one another can alleviate pressure. Additionally, I make use of short breaks when possible to recharge mentally. Staying committed to providing quality care helps me remain focused on what truly matters. 13. What do you consider to be the most challenging aspect of being a nursing assistant? One of the most challenging aspects of being a nursing assistant is managing the emotional and physical demands of the role. Assisting patients with personal care can be intimate and requires a strong sense of empathy and patience. Additionally, dealing with patients who are in pain, anxious, or uncooperative can be difficult. Balancing these emotional challenges while ensuring that care is delivered efficiently adds to the complexity of the job. Time management is also crucial, as multiple patients may need assistance simultaneously, requiring swift prioritization of tasks. 14. How would you communicate with a patient who has difficulty understanding or speaking? Effective communication with a patient who has difficulty understanding or speaking requires patience and creativity. I would start by using simple language and visual aids, such as pictures or gestures, to convey information. Active listening is essential. I would encourage the patient to express themselves in any way they can, whether through nods, gestures, or writing. Establishing a calm and supportive environment fosters trust, making it easier for the patient to engage. Additionally, involving family members or caregivers can help facilitate communication and ensure the patient feels comfortable and understood. 15. Can you explain your approach to maintaining patient dignity during care procedures? Maintaining patient dignity is paramount in care. I approach this by first establishing a rapport with the patient, ensuring they feel valued and respected. During care procedures, I always explain what I am doing and why, allowing them to express any concerns. I prioritize privacy by using screens or curtains and only involve necessary personnel. Additionally, I pay attention to their comfort, both physically and emotionally, by asking for their preferences and accommodating them when possible. This respectful communication fosters trust and enhances the overall care experience for the patient. 16. What would you do if a patient refused care or assistance? If a patient refused care or assistance, I would first ensure that they understood the implications of their decision. I would calmly ask them to share their concerns and listen actively, providing them with the space to express themselves. After understanding their reasons, I would offer information about the benefits of the care they are refusing and address any misconceptions. If they still declined, I would respect their autonomy while documenting the refusal and informing the relevant healthcare team members, ensuring that the patient feels supported and respected in their choices. 17. How do you stay updated on current healthcare practices and procedures? Staying updated on current healthcare practices and procedures is essential in the ever-evolving field of healthcare. I regularly engage in professional development by attending workshops, seminars, and online courses related to nursing and patient care. Reading reputable nursing journals and publications is also a key part of my routine, as it provides insights into new research findings and best practices. Additionally, I participate in professional organizations and online forums where healthcare professionals share knowledge, experiences, and updates on recent changes in the industry. 18. Describe a situation where you had to work effectively as part of a team. In my previous role at a care home, our team faced a challenging situation when we had an influx of new residents. We quickly organized ourselves and assigned specific duties based on each member's strengths. I took on the responsibility of coordinating communication between nursing staff and support workers, ensuring everyone was informed about each resident's needs. This collaboration allowed us to provide personalized and timely care, which led to a smoother transition for the residents and a more efficient workflow for the team. The experience reinforced the importance of teamwork in delivering quality care. 19. What do you know about the current challenges facing the NHS? The NHS is currently facing several significant challenges, including funding constraints, staffing shortages, and increasing demand for services. Budget limitations affect the ability to maintain high-quality care and invest in new technologies. Staffing shortages, exacerbated by high turnover rates and burnout, place additional strain on existing healthcare workers. Furthermore, there is growing pressure from an aging population with complex health needs, which demands a more integrated approach to care. Addressing these challenges requires innovative solutions, collaboration among staff, and a focus on improving employee well-being to ensure the NHS can deliver effective patient care. 20. How would you handle a situation where you made a mistake in patient care? If I realized I made a mistake in patient care, my first step would be to acknowledge it immediately and assess any potential impact on the patient. I would inform my supervisor or the registered nurse on duty to ensure the patient receives the necessary care and support. Transparency is crucial, so I would document the incident accurately and participate in any required debriefing or investigation. Learning from the experience is essential, so I would reflect on what went wrong and seek guidance or additional training to prevent similar mistakes in the future. Communication with the patient and their family would also be prioritized to maintain trust. 21. Can you explain your understanding of manual handling protocols and their importance? Manual handling protocols are essential guidelines designed to ensure the safety of both healthcare workers and patients during the transfer and movement of individuals. These protocols emphasize proper techniques for lifting, carrying, and supporting patients to minimize the risk of injury. They include assessing the environment before moving a patient, using equipment such as hoists or slide sheets when necessary, and ensuring that the patient is comfortable and safe throughout the process. Following these protocols not only protects staff from musculoskeletal injuries but also maintains the dignity and safety of patients during care. 22. How do you ensure accurate record keeping and documentation? Accurate record keeping and documentation are essential in healthcare. I ensure this by following established protocols and guidelines, using clear and precise language in all entries. I double-check all documentation for completeness and correctness, including patient details, care provided, and any observations. Utilizing electronic health record systems helps maintain accuracy and accessibility. I prioritize timely documentation, completing records promptly after providing care, which aids in continuity and quality of care. Regular training sessions and staying updated on best practices also contribute to maintaining high standards in record keeping. 23. What strategies do you use to build rapport with patients and their families? Building rapport with patients and their families involves active listening, empathy, and respectful communication. I make an effort to understand their concerns and preferences, which helps establish trust. Using open body language and maintaining eye contact shows that I am engaged. I also take the time to introduce myself and explain my role clearly, ensuring they feel comfortable. Sharing relevant information about their care and encouraging questions fosters a collaborative relationship. Personal touches, like remembering names and discussing interests, help create a warm and welcoming environment. 24. How would you respond to a patient expressing concerns about their treatment? When a patient expresses concerns about their treatment, I would first listen attentively, allowing them to share their feelings and thoughts without interruption. It's crucial to validate their feelings and reassure them that their concerns are important. I would ask clarifying questions to better understand their specific worries. After that, I would provide clear and honest information regarding their treatment plan, ensuring they have a comprehensive understanding. If necessary, I would involve the healthcare team to address their concerns further, ensuring the patient feels supported and cared for throughout the process. 25. Can you describe your experience with measuring and recording vital signs? In my previous role as a nursing assistant, I frequently measured and recorded vital signs such as blood pressure, heart rate, respiratory rate, and temperature. I followed established protocols to ensure accuracy and consistency. I used electronic monitors as well as manual techniques, depending on the situation. It was important to document the readings promptly and accurately in patient records. I also communicated the results to nurses and provided support to patients by explaining the importance of these measurements in monitoring their health. This experience enhanced my attention to detail and my ability to work efficiently in a clinical setting. In this video, we explored the top 25 NHS Nursing Assistant interview questions and answers to help you prepare effectively for your interview. Understanding the nuances of these questions can significantly boost your confidence and performance. Remember, preparation is key to showcasing your skills and dedication to patient care. If you found this content valuable, please give it a like and share it with others who might benefit. Don't forget to subscribe for more insightful videos that will assist you in your career journey. Thank you for watching.